Okay, so before I discuss the proper technique on how to do a correct semen analysis, let's review first the anatomy and physiology of the male reproductive system. So externally, you get to see your penis, and then inside the scrotum are two testes. Okay, so these are actually your gonads, which serves to produce the cells that will later develop and mature into sperm cells. And your male reproductive system is comprised of exocrine glands. So from the term itself, exocrine, meaning these organs or glands are actually responsible for secreting fluid substances. And these fluids will actually make up your semen that we use for semen analysis. Okay, now these exocrine glands are as follows. So we have two bulbourethral glands, two seminal vesicles, and your prostate gland, whose secretions form the seminal fluid. No? So in addition to these secretions are actually the sperm cells which are produced from your gonads. So basically, when we talk about semen analysis, we're actually talking about the sperm cells contained in the fluid secreted by these exocrine glands that I have mentioned a while ago. So externally, you get to see these structures in the male reproductive system. So we have here, shown here is the glands of the penis, okay? And on the tip of the glands is actually a meatus or an opening which is connected to the urethra. No? So this is where the urine or the semen passes through. Okay, and the glans penis is connected to the body. No? It has a body which we call shaft. So during arousal or sexual stimulation, what you get to see is a a, a longer, no, a longer, more pronounced, rigid, rock hard na shaft of the penis. It's because this part of the penis is actually made up of erectile muscles. Okay, so you have learned that from your anatomy. And just beneath the penis is a a skin-like structure. No, your scrotum, a loose skin-like structure, your scrotum. So what's important to note there is that your scrotum actually has corrugations, and your scrotum is connected to a muscle, no, the dartos muscle. How come? What's the purpose of that muscle? It's actually helps to maintain a particular temperature. It's because if the temperature is too hot, okay, what happens is that your dartos muscle relaxes, and so your testicles, your testes will actually not be in close contact with your body, no? So it will be suspended. Whereas if there is a very cold external temperature, what's likely to happen is that your dartos muscle will be contracted, a contracted state, such that it brings your testes closer, okay, closer to your body. That is to maintain the proper temperature for semen and sperm cell maturation and production. So internally, your penis is comprised of three structures. So I have mentioned already the glands and the body. No? So what's important to note there is the root. No? So notice that externally, what you just see is the body and the glands, but it's actually longer than what you think. Okay? So what's connected from the body is the root. Okay? And what I will be discussing more are the structures inside the scrotum. Okay, so let's start with the testis. What do we see inside? So this is how it looks like. So your testis is comprised of lobes of seminiferous tubules. So these seminiferous tubules contain germ cells or cells that will later mature into sperm cells. Okay? So notice that your seminiferous tubules are coated by a connective tissue called tunica of Eugenia, and each tubule is separated by a septum, okay, forming lobules. Now, from these seminiferous tubules, so these coalesces, okay, the projections coalesces, eventually extending into the epididymis, where your sperm cells mature. So the germ cells that will soon develop into mature sperm cells are actually produced in the seminiferous tubules. And these cells now, okay, are later brought into the epididymis for maturation. Now, during stimulation, during the process of ejaculation, what's going to happen is that the matured cells that are stored in the epididymis actually goes into the ductus or vas deferens. And from that vas deferens, okay, it goes forward, it propels forward. So from there, from the ductus deferens, it actually goes it passes through the ampulla of the ductus deferens, and it goes to the ejaculatory duct. Okay, this is the structure. So in the ejaculatory duct, notice I have mentioned that the male reproductive system is comprised of exocrine glands. And the first exocrine gland here that we will encounter is the seminal vesicle. Okay, so as I mentioned that exocrine glands are capable of secreting fluids. So in the ejaculatory duct, the sperm cells that passes from the vas deferens, the vas deferens mixes with the secretions, the fluid from the seminal vesicle. Okay, so what's important to note here is that the fluid that is secreted by the seminal vesicles are actually rich in fructose. Why? What's the purpose? No, so basically it's sweet, no, kay fructose man. So the purpose of the fructose is to actually give energy. It will become a source of energy later for the sperm cells. Okay. So aside from it gives a fluid, no, that will serve as a nutritional support for your sperm cells as it travels to the female genital tract. Alright. Now from the ejaculatory duct, it fuses with the prostatic urethra. Okay? So by the term prostatic urethra, this is actually a passageway, that is enclosed by or surrounded by the prostate gland. Okay? So from there, we expect another secretion from your prostate, okay, your prostatic gland. So the substances, okay, that were mixed in the ejaculatory duct, we have your sperm cells and your secretions on the seminal vesicles. And when it reaches the prostatic urethra, it becomes mixed with the secretions from the prostate. So what's distinct about these secretions from the prostate is that this is actually acidic in nature. Okay, so the secretions from the prostate are actually acidic. It contains enzymes, it contains zinc and other substances, okay, that are responsible for lysis, no? Responsible for lysis of the coagulated seminal fluid. Now, from the prostatic urethra, the secretions propels forward into the membranous urethra, and from there it mixes with another secretion secreted by your bulbourethral gland. Okay, Now, what's characteristic here, what's peculiar here is that the secretions secreted by the bulbourethral gland are actually alkaline in nature. No? It's actually comprised of a thick alkaline fluid. Why? It's because these alkaline secretion will actually neutralize the acidic environment in the vagina, no? Which is actually detrimental to your sperm cells. So we get to see actually a more or less acidic secretions now because of the alkaline mucoid fluid secreted by your bulbourethral gland. Take note of these exocrine glands. No? The majority of the seminal fluid is secreted by your seminal vesicle. Okay. Now from the bulbourethral gland, the secretions passes into the urethra. Okay, the spongy or penile urethra, and then eventually going out, going out to the urethral meatus, no? To be delivered into the vaginal tract or to the external environment. Okay, so this is another diagram showing you the entire tract, no, to where your sperm are propelled and where it mixes with the different fluids secreted by your exocrine glands. So from the testes, the immature sperms goes into the epididymis where it develops flagella and it, it becomes mature, and then during stimulation it is propelled forward into the ductus deferens, and from the ductus deferens it mixes with the fluid in the seminal vesicle. No? So your seminal vesicles are found behind the bladder, and the mix, the fluid goes into the prostatic urethra where it mixes with prostatic fluid, and then from there it goes into the membranous urethra where it mixes with the fluid secreted by the bulbourethral glands, and then goes into the spongy urethra, eventually going out. Okay, so this is another diagram showing you the different structures, not just the same. So let's talk about the different stages in the development of sperm from the mature, no? From a germ cell to a mature sperm. So basically, we have 5 stages are involved in the development of sperm. So the germ cells here is what we call spermatogonia. And then spermatogonia matures into a primary spermatocyte, and then into a secondary spermatocyte, and then into a spermatids. No? So from spermatids, these are actually the actual cells which will mature into a sperm. So let's discuss this in detail. So notice that you actually have your germ cells here. These germ cells are actually called spermatogonia. So your germ cells, when you are on the right age, okay, so this will develop into it will give rise into 2 daughter cells. No, we call it the type A daughter cell and type B a daughter cell. So your type A daughter cell will actually remain in the seminiferous tubules. Okay, will go back to the seminiferous tubules and replenish whatever spermatogonia that have developed into a mature sperm, so that if there is replenishment of the spermatogonium that has developed into a mature sperm, okay, it will actually make sure that you have a constant, no, sperm concentration, a constant supply of your sperm. Now the daughter cell type B is actually the progeny, the daughter cell that will mature into sperm. Now your daughter cell type B, as it matures, it gives rise, it becomes primary spermatocyte. Your primary spermatocyte undergoes a process of meiosis. Okay, so it has to be labeled meiosis 1 because the process of spermatogenesis is comprised of two meiosis. So meiosis 1, under meiosis 1, what happens is that it gives rise to two haploid cells. So two haploid cells. Now from a 43 chromosome, so the chromosomes are, it gives rise into two daughter cells, each daughter cell containing half of the original chromosomes from the primary spermatocyte, giving rise to secondary spermatocytes. Two secondary spermatocytes. These secondary spermatocytes undergoes the process of meiosis 2. So what's distinct from meiosis 1 is that meiosis 1 involves production of haploid cells, whereas your meiosis 1 is just like a process of mitosis. It's because your cells will actually not undergo chromosomal, okay, will not undergo chromosomal reduction. So it just maintains the haploid number of your chromosomes. But then the cells, each secondary spermatocyte will undergo cell division, giving rise to total of four spermatids. Now, these spermatids will actually develop flagella, they will mature, they will learn how to swim in the epididymis. Okay? And once mature, they are temporarily stored in the epididymis until it is excreted out in the process of ejaculation. So what's important to note here is that one one daughter cell, type B, will produce four mature sperms. Another note here is that the entire the entire spermatogenesis is comprised of three major processes. A process of mitosis, followed by two stages of meiosis, and eventually spermiogenesis, okay, which is maturation of your sperm, spermatids into sperm, spermiogenesis. So this is a summary of the different functions of each organs that make up the male reproductive tract. So again, your seminiferous tubules is responsible for your spermatogenesis. Your epididymis is the area where your sperm matures. Your ductus deferens propels the sperm to the ejaculatory ducts. Your vesicles will provide nutrients for sperm and fluid. So what nutrient is that? Fructose. Your prostate gland is responsible for production of enzymes, acidic enzymes, and proteins for coagulation and liquefaction of your semen. And then we have your bulbourethral glands, which is responsible for production of your alkaline fluid. So the entire semen, the entire fluid, from plus the sperm that is produced or excreted during ejaculation is comprised of the following. So we have your sperm cells or your spermatozoa, okay, will just actually comprise 5% of the total secretions, whereas your seminal fluid, as I have mentioned, comprises the majority of the fluid, comprising about 60 to 70%, followed by your prostate fluid and your bulbourethral gland fluid. Now, these are the other substances that are contained in your semen. So we have your alpha glucosidase, your zinc, your citric acid, and acid phosphatase. So these are actually substances secreted by your prostate gland and some by the seminal vesicles. So the the patient preparation. Okay, patient preparation for semen analysis specimen collection are as follows. So first and foremost, I need to emphasize this. There must be a period of sexual abstinence. Okay, so no sexual contact with anyone, no masturbation, for at least 2 days to no longer than 7 days. Okay, why? So what happens is that if you collect the specimen of less than 2 days of sexual abstinence, most likely you are to get inadequate sample. Okay, so that's why you need at least 2 days. Now, not more than 7 days. Why not more than 7 days? It's because this will actually give us an increased fluid volume, but this increased fluid volume would actually impede, no? It will actually cause longer time for liquefaction, and it will actually cause impedance or impede sperm motility. Alright? So giving us false results in your semen analysis. That's why the recommended duration or period of sexual abstinence is at least 2 days to not more than 7 days. Now, the WHO recommends that 2 or 3 samples must be collected not less than 7 days. Okay, take note. So the 2 to 7 days is actually from Strassinger. Your WHO recommendations would be not less than 7 days, more or less just the same, no? Or more than 3 weeks apart, with 2 abnormal samples considered significant. Okay, and then when collecting the specimen, you need to collect the entire ejaculate. Okay, so I think the male students are actually can relate to this. So remember, when you ejaculate, there are actually portions, no, if your ejaculation. So we have this what we call precum, no. So the precum is actually a smaller portion of the entire fluid that you will collect. However, that first portion of the ejaculate contains majority of the sperm cells. That's why failure to collect that first portion of the ejaculate will actually lead to false decrease in sperm count or sperm concentration. Now, the second portion of the entire ejaculate would actually contain larger volume, no more of the fluids. Now, failure to collect that portion, failure to collect everything, the second portion of the ejaculate would actually result into lower volume. Okay, thus thus it will give us false results during semen analysis. Now, the laboratory should provide the patient with warm, sterile glass or plastic containers. Now, during your laboratory exercise, you will be provided with a plastic containers with sterile plastic containers with a cup. No? And take note that these containers must be sterile. Okay, that is to avoid contamination of the sample. Now, it is important to label the container with the following details. Okay, so the patient's name and the birth date, no, for patient identification, the period of sexual abstinence, so that the examiner will be able to know, no, if the patient has followed the recommended protocol for period for sexual abstinence, which is not less than 2 days to no more than 7 days. The completeness of the sample. So how do you check for the completeness of the sample? So you measure the volume, no, of the fluid that you have collected. So any difficulties with collection. So the usual difficulty of collection here is that um, for some patient it will be difficult, no, to for them to ejaculate. No? So for example, patients who have difficulty with collection. Anyways, cut lang na siya. cut to cut. And we need also to note the time of specimen collection. So why do we need to note for the time of specimen collection? Remember, during semen analysis, you actually don't perform immediately. No, after you have collected the sample, you actually do not perform immediately the analysis. Why? It's because your your ejaculate is actually in a form of coagulum. So, meaning if it is in a form of coagulum, it will actually impede movement or motility of your sperm. It will be difficult for you to do cell counts. Now, what you need to do is that from the time of ejaculation, complete ejaculation, you need to note at least 30 to 60 minutes no, before you could actually do the semen analysis. So that 60-minute period will actually be the exact time for the entire coagulum to liquefy. In other words, the purpose of putting time of specimen collection is to actually note for the time of liquefaction. So I will be discussing that in detail later. Okay, and the preferred method of specimen collection is by masturbation. Now, during masturbation, it is not recommended to use condoms. No, why? It's because remember your condoms will contain spermicides. So this will actually kill your sperm cells, eventually giving us false decreased spermatic concentration. So again, the preferred method of specimen collection is by masturbation. Now, some fertility labs no, would actually provide a separate room for specimen collection wherein you get to see a big TV screen or magazines, pornographic films that will actually help you, no, that will actually stimulate you, helping you with the specimen collection, no? Okay. So again, the preferred method of specimen collection is by masturbation. So after you have performed the entire analysis is that you have to discard this in the biohazardous waste bag. It's because remember, this might be a reservoir or source of HIV infection or even hepatitis infection or any other sexually transmitted diseases. And sterile materials must be used, especially if culture should be performed. Okay, so now let's talk about the different procedures no, involved in semen analysis. So these are the normal values no, that you need to take note when doing semen analysis. So these are the parameters reported. So first, the volume of the specimen. Okay, take note that the normal volume for your fluid is 2 to 5 ml volume. And then a this would actually tell us no many things. The volume will actually tell us so many things. For example, if you have collected a volume of less than 2 ml, that would actually mean the patient had inadequate sexual abstinence. Okay, or it might be in cases wherein there is retrograde ejaculation. Okay, so I'll give that as a assignment to you. No, you have to read on that. What does that mean? No, retrograde ejaculation, and what happens? How does it affect your specimen volume? No, that will surely come out in your examination. Now, a volume of more than 5 ml would actually mean you had a sexual abstinence no, of more than 7 days. Okay, or it might be contaminated with other fluids such as urine. So you need to take note of the color also. And then the proper another parameter The proper way of measuring the volume is by using a calibrated glass, no, or cylinder glass. Now, another parameter is your viscosity. Okay, so remember, we let before we could do the actual semen analysis is that we let the fluid stand for 30 to 60 minutes. Remember, that would actually allow the enzymes, no, secreted by your prostate gland to take effect, no, that will actually cause liquefaction of your coagulum, no, by the enzymes. Now, the normal viscosity of the fluid is that it must pour in droplets. Okay, so what would it mean, no, if the viscosity is actually very high, no, the fluid is viscous, and if it does not pour in droplets, that would actually mean you have a problem with the secretions, no, with the prostate gland, no, that might uh, cause deficiency, no, of the enzymes that will actually cause liquefaction of your specimen. Now, pH is another parameter that we need to determine, and this is determined using a reagent strip, no, urine reagent strip. So the normal pH is 7.2 to 8.0. What you need to take note is that in infectious process, okay, so you'll get to notice a higher na pH. So a higher pH would mean there might be infection or the specimen is contaminated. Now, a normal sperm concentration is more than 20 million per ml. Again, more than 20 million per ml. And the normal sperm count is more than 40 million per ejaculate. So how do you get the sperm count? No? So you just multiply the sperm concentration with the volume. So the normal volume is at least 2, no? So 2 times 20, so you get 40 million. 40 million per ejaculate. Okay, take note of the unit. Now, the another parameter that is reported in a semen analysis is motility. Of course, we need to note for the motility. It's because sperms which are not motile or sperms which have lesser than normal motility would eventually die and would not reach the egg cells, no? Egg cell. So in normal motility of sperm cells, actually in more than 50% of the entire sperm cells, no, within an hour. So quality also of the motility is graded as 2.0 or ABC grading. So I will be discussing this in detail later. And the normal morphology. So how do we assess the morphology? So we stain the specimen with either Papa Nicolau stain. Okay. So we stain it or with GEMSA stain. So a normal value of more than 14% using the strict criteria or Kruger's strict criteria, and a normal value of more than 30% normal forms using the routine criteria. So I will be discussing this in detail later. Now, round cells are actually those cells not found in the stained specimen other than your sperm cells. So this might include WBCs or your immature sperm cells. So this should be less than 1 million per ml. So semen analysis is comprised of both macroscopic and microscopic examination. Okay, so unlike your urine analysis is comprised of three examinations. So we have macro, chemical, and microscopic. So more or less your semen is comprised of macroscopic and microscopic examination. So I have mentioned already the different parameters reported. Okay, so let's identify which one is macroscopic, which one is microscopic. So your volume, the viscosity, the pH, these are actually macroscopic examination. No? Whereas your sperm concentration, your motility, the quality, morphology, and round cells are actually the microscopic examination parameters. So The appearance of the semen is actually normally gray-white color. It appears translucent, has a characteristic musty odor. Now, what I want to point out here are the instances wherein your specimen does not appear gray-white color. So, if you receive the specimen, no, so you need to take note if it is gray-white or not. Why? So you visually, no, by visual inspection or by visual examination, you take note of the color, and then by finding, no, you take note also of the odor of the specimen. Now, a gray-white, an increased white turbidity would actually be present in conditions such as infections. Okay? Varying amounts of red coloration is usually present in instances wherein your specimen is contaminated with blood, and yellow coloration happens, no, when there might be in cases wherein there is contamination of urine. Okay, take note, your urine is actually toxic to the sperms, no? So it will actually cause a false decrease na sperm concentration results. So this is how it would look like, no? Gray-white translucent fluid which has a musty odor. So after you have collected the specimen, you have examined the color and the odor, so you let the specimen stand in room temperature at 30 to 60 minutes. Okay? What's the purpose of standing? Remember, your specimen that you have collected is initially a coagulum or clotted, and the enzymes found or secreted by your prostate gland are actually responsible for liquefying this clotted or coagulum, seminal fluid, semen. So it would actually take normally 30 to 60 minutes for it to completely liquefy. Analysis of the specimen cannot begin until liquefaction has occurred. Why? Because the coagulum would actually cause impedance or would impede sperm motility. So it will be difficult for you to assess other parameters. Now, if after 2 hours the specimen has not liquefied, so you need to induce liquefaction by Dolbeck's phosphate buffered saline, no? So and proteolytic enzymes using bromelain. No? So this is actually found in your notes. Please go over on the entire procedure. What I want to point out here is that if you have induced liquefaction, you need to note, no, in the result sheet that you have induced liquefaction by using what particular method, by what particular chemical method. Now, the normal volume ranges between 2 to 5 ml. So I've mentioned already, less than 2 would mean inadequate specimen sample collected, more than which might indicate inadequate sexual abstinence. A specimen volume of more than 5 may mean over, no, prolonged abstinence, or in cases wherein it is contaminated with other fluids. So it is measured using graduated cylinder calibrated in ml increments. Now, viscosity is okay. Assess also, no, after you have assessed other macroscopic parameters. So the normal finding here is that the specimen must pour in droplets. Okay. So this is how it would look like. So a more viscous specimen would mean there is inadequate enzymes produced by your prostate gland that will cause liquefaction. Now, pH is measured within an hour of ejaculation using a urine reagent strip, and a normal pH is alkaline, no? 7.2 to 8. So more than 8 would mean a more alkaline specimen which is present in infection. So sperm concentration and sperm count. So the actual, in these procedures or parameters, we actually note for the actual number of sperm present in the semen. Okay, and sperm concentration is usually performed using a a a specialized equipment we call Neubauer counting chamber. So I think this is not new to you, no, because you had this in your hematology classes. You have used this in your hematology classes. So the total sperm count for the ejaculate. So the sperm count is calculated by multiplying the concentration by the volume. That's why you need to note the exactly the volume that has been measured. Okay, so this is how it would look like under the microscope. Notice that you have this what we call here WBC and RBC squares. No, so the larger corner squares are your WBC squares, whereas your smaller central squares are your RBC squares. Okay, so this is actually represented by one, no, by one chamber. Now, the dilution that you are going to use is 1:20. Okay, so if you use the RBC squares in counting, okay, you express the result no per ml. So, or if RBC squares are used, so you just whatever cells that you have counted, you just multiply immediately with 1 million. Now, if you use WBC squares in counting, okay, so whatever cells that you have counted here is actually, no, the unit that you are using is actually per microliter, no, cells per microliter. That's why you need to multiply with 1000 the number that you have, whatever number that you have computed no, per microliter. So again, that is how you compute for your sperm concentration. For your sperm count, you multiply the sperm concentration with the volume. Okay? So another parameter that we need to take note is the sperm motility. So normally, your sperm is capable of forward progressive movement, which is critical for fertility. So motility should be assessed using a well-mixed liquefied semen specimen within 1 hour of collection. So this is done using a 10 microliter fluid examined under a cover slip in high power fields, 20 high power fields. So an alternate procedure is to examine 200 sperm per slide and count the percentages of the different motile categories using a manual cell counter. So the WHO recommendation is actually a simpler grading that does not include speed, okay, because of the difficulty in standardized reporting. So another more advanced way of assessing your sperm motility is through CASA, or your computer-assisted semen analysis. So it's actually your computers which will assess the motility. So this is how you grade for the motility. So we have the normal grading, numerical grading of from 0 to 4, okay, with using the WHO criteria from A to D, okay. So, or another alternative is by grading it as PM or progressive motility, NP, non-progressive motility, or IM or immotility, no movement at all. So, another parameter that we examine is the morphology. So, we stain the slide, we stain the slide with a stain, we can use Gemsa stain or Papa Nicolau stain. So at least 200 sperm cells should be evaluated and the percentage of abnormal sperm is reported. So we may make use of the Kruger's criteria wherein we need to measure the head, the neck and the tail size of the sperm. We measure the acrosomal cup also and the presence or absence of vacuoles. So these requires another equipment we call micrometer or morphometer. So in this parameter also assessment, we differentiate the other cells, cells other than your sperm cells. We term this as your round cells. These are actually cells found in the fluid other than your mature sperm cells. So this might refer to WBCs or immature sperm cells. Okay, so this is usually made with the same stain slide that you use for sperm morphology determination. So for Kruger's three criteria, we need to measure the head, the neck, and the tail, or we also make you measure the acrosomal cap. So the acrosomal cap actually occupies one half of the entire head and two-thirds of the nucleus. And then also the mid piece, or the mid piece, we measure that in Kruger's criteria and the measurement of the tail. Okay, so these are the abnormal morphology of the cells. So normally you have one head, a mid piece, and a tail. Now, when you say of double head, you actually have two heads. The one tail, two heads plus one tail. Or giant head, okay, bigger than the usual measurement. Amorphous heads are actually a lysed head without any acrosomal cap or any nucleus. Thin head or small head, we have also a tapered head. So these cells are actually incapable of penetrating to the ovum. We also have constricted head, double tail, coiled tail, and spermatids. Okay, so the any discrepancies or any abnormal morphology involving the head would actually result in difficulty in penetrating the ovum, whereas any abnormal morphology associated with the tail would actually cause an abnormality in sperm motility. Okay? So these are the additional tests that we can do other than the routine parameters that I have mentioned. So we can test for sperm vitality. So this will test if your sperms are actually viable or not. Okay, so sperm vitality is done by staining. The stain used is eosin nigrosin stain. So if your sperm is alive, what's likely to happen is that the dye could not penetrate. So a normal result would be the presence of a bluish stained sperm. Whereas if your specimen contains dead sperm cells, what's likely to happen is that your eosin nigrosin stain would actually penetrate through the entire cell, giving us a positive result of orange or red coloration. So these are actually dead sperm cells. Or we can assess also for fructose, where what particular part of the reproductive tract, seminal vesicles. Okay, so this will actually provide nutritional support to your sperm so that they could actually propel or swim forward, going to the location where the ovum is. So a low levels would mean that a low sperm concentration would mean that you might have low fructose levels. So the method for testing is the resorcinol test or spectrophotometric determination of fructose levels. So another is determining the presence of anti-sperm antibodies. Okay, so this is performed using mixed agglutination reaction or immunobead test. Now, another tests are microbial and chemical testing. So usually we do culture for microbial. And for chemical testing, we test for other components of the seminal fluid such as your alpha-glucosidase, L-carnitine, disulfophosphocholine, and etc. Other enzymes. And Another test that we do no is to check for completeness of vasectomy. So remember, vasectomy is actually um, cutting no your vas deferens no, so that your sperm now from the epididymis would not propel forward. It will actually be stuck there and eventually be dead. Okay, so normally for a vasectomized patient, you actually can still ejaculate semen, but that semen does not contain any sperm. Because remember, in vasectomy, you just cut the ligate, no, the vas deferens where your sperm passes. So, but any other parts found beyond are actually um, comprised of the exocrine, no, exocrine glands, which is capable of producing or secreting exocrine fluids. Okay, so specimens are tested at monthly intervals beginning at 2 months post vasectomy and continuing until two consecutive monthly specimens show no spermatozoa. So sperm function tests are as follows. We have hamster egg penetration assay, cervical mucous penetration test, hypoosmotic swelling test, and in vitro acrosome reaction. So this I actually posted a table no in your notes. No? So please run through these tests. No, what are these tests for? Okay. So that ends my lecture for semen analysis. Thank you very much. Let me end my lecture with this quote. No? I can and I will watch. Thank you so much. Have a good day.